right, welcome back. This is Power Breakfast on Citizen TV. Tuesday means it's time for us to share some health tips with you. And this morning we are going to be talking about glaucoma. I am joined in studio by Dr. Cindy Ogundo. How about you introduce yourself with your full titles and all of that?
Good morning. I don't actually have very many titles. Okay. I'm just Dr. Cindy Ogundo. I'm an ophthalmologist. I currently work in the public sector at Mbagathi Hospital.
Okay.
Yeah.
All right. Welcome and thanks for joining us. Remember, as we're having this discussion, and if you have any questions about what we are going to be talking about, go ahead and tweet at Citizen TV Kenya at Joey_Muthengi. Use the hashtag Power Breakfast. I'll check for your questions for Dr. Cindy as we go along. So let's start by defining what glaucoma actually is. Some of us understand it as a group of eye conditions that may lead to blindness, but perhaps from your perspective you have a different definition?
Not entirely, maybe just sounds more medical.
Okay.
So glaucoma is a group of diseases, and it's basically defined by the characteristic of deterioration of the optic nerve. What that basically means is it's a disease that affects the nerve that connects the eye to the brain, and what that nerve does is carry visual information, and in essence, that's how we see. We don't actually see with your eye exactly, you see with your brain. Mm-hmm. So you need a connection between the two. And if something happens to destroy that nerve, then in a particular characteristic fashion, there are certain criteria we use to decide that this is now glaucoma or this is something else that has destroyed the nerve.
Okay.
Yeah.
Now, how common is this disease? Because I understand is it one of the leading causes of blindness or the leading cause of blindness in the world?
It is actually the leading cause of irreversible blindness.
Okay.
So we have blindness that we can treat and you can get your sight back. So the overall leading cause of blindness in the world is actually reversible, and that's cataract, which is about 47.8% worldwide. Glaucoma is the leading cause of irreversible blindness, meaning once you go blind from glaucoma, there's really not much we can do. And that's at a prevalence of about 12.3, which I know sounds small, but if you think about it in terms of numbers, in 2013, there were 64.3 million people estimated to have glaucoma. Wow. And by 2020, we expect that number to have risen to 76 million people.
Wow, which is a scary statistic.
Which is a very scary statistic.
So the leading cause of irreversible blindness.
Irreversible blindness.
Some people kind of group in cataracts, glaucoma, like all sort of eye diseases in there together.
Well, yes, we do sort of group them together because they can all lead to blindness. Mm-hmm. The only difference is that with cataract, we can restore your vision, whereas with glaucoma, whatever vision you have lost, we cannot restore it. We can slow down the progression, but we cannot restore what has been lost. Mm-hmm. As yet, we don't quite know how to revive the optic nerve.
Well, this is quite a serious disease from the sounds of it. What are some of the first signs that someone is experiencing this disease?
Now, that's kind of variable because it depends, one, on the type of glaucoma you have. But generally, most patients will not realize they have a problem because it is generally pain-free. Mm-hmm. And as you lose your vision, you lose it so slowly that unless you actually need very good vision for whatever work you do, it's unlikely that you will notice it early, which is why we advocate for screening, because when you're screened, we can pick up the early signs before you as the patient start noticing that there's any problem.
So if there's no pain involved and you're not noticing the signs, what type of time frame are we talking about between when symptoms may have started and when they might be discovered?
It can be as much as even 10 years. Ah. Yes.
Right.
Yeah, because it starts off very slowly as the nerve is dying off, and you do maintain very good central vision for quite some time. Mm-hmm. So meaning that if I look straight ahead, I can still see. But what you start losing is your peripheral vision. So if I'm looking straight ahead, I should be able to see to my side. Like when you're driving, you don't need to turn your head completely to see the vehicle that's coming from the side. So that's your peripheral vision at work. So if you notice that I now need to turn my head to see the vehicle or the person coming from my side, then that's pretty much an early sign of what you expect. You also have different types of glaucoma where maybe when you look at lights or you look at the TV, you're going to have a halo around it. Okay, so you'll see some colored lights around it that's not really quite normal. So that could also be an indication. Sometimes you can have sudden episodes of sharp pain if your angle closes over. So that may be something else that maybe you could look out for. Yeah. But in general, the risk factors for glaucoma would be increased intraocular pressure, which you can't tell. We would have to tell you that you have that. Okay. But the other thing is your race. People of African descent are known to have glaucoma more likely than people of Caucasian descent. Your age, anyone above the age of 35, then there's a risk that you could get glaucoma. Your family history. If anybody in your family has been diagnosed with glaucoma, it's a good idea to have everyone in your family checked out because it's very possible that you could have that as well.
Yeah. You touched briefly on the different types of glaucoma, and I know, you know, for the average person thinking about this disease, we're thinking this affects old people. But
yes.
That's not all.
No,
right?
that's not entirely true. It is mostly a disease of, well, I'm not sure 35 is an old person, but
older.
Yeah, so it is a disease of older people, but you can be born with glaucoma or you can acquire glaucoma in the course of your life. So children who are born and have symptoms of tearing, they can't look at the light, it's like they have to keep closing their eyes and they keep squeezing their eyes. Those are children that we need to take for a checkup, because some of those signs, we refer to them as epiphora, photophobia, and blepharospasm. Those are the cardinal signs of glaucoma in a child, for congenital glaucoma. You can get glaucoma when you're a little bit older. It's called juvenile glaucoma. Again, sometimes just because of your genetics, sometimes because of trauma. You got hit in the eye and things changed a bit in the eye. Sometimes just because of repeated infection in the eye, you can get glaucoma as well. And diabetic patients also can get glaucoma.
At a higher risk.
They're at a higher risk for glaucoma, yes.
Right. You mentioned screenings as well. Take us through the process of diagnosis when it comes to this disease.
So unfortunately, there's not just one quick test that can tell you have glaucoma. There's a series of tests that we do. So for the screening process, we mainly do 2 tests because they're fairly simple and quick to do. One, we will measure your eye pressure. This is different from your blood pressure. I get that question a lot. Your eye actually does have pressure. It's called intraocular pressure. So that is what we will measure. So if you do not have hypertension, that does not mean that you do not have glaucoma. And the other thing that we will look at is we'll look at your optic nerve. So we can look into your eye and take a quick look at your optic nerve, the head of your optic nerve. And there are certain changes. If we see, then it tells us that you have glaucoma. So generally, it's a fairly quick test. We use a direct ophthalmoscope to look in there. We can use other equipment to do that, but it's pretty simple doing it with a direct ophthalmoscope. And if you go for screening, that is most likely what will be used on you. The other test we do use to decide whether someone has glaucoma, especially if the first 2 we are sort of borderline, not very sure, we do a visual field. So we check how far you can see to your side without moving your head. Like I said, that's one of the things that tells you you probably have glaucoma. So we'll take a look at the results from that test, and there are certain characteristic patterns. If we see that, then it tells us that you have glaucoma.
So is this a case of having regular screenings? Is that what you do encourage?
Well, not as regular as, say, something like diabetes or cervical cancer, but we do encourage those over 35 to get screened. If you have your initial screening, depending on what you're told, you could even wait another 2-3 years before you have your screening again. Yeah.
Right. So treatment.
Yes.
You've talked about it not being reversible, but you said you can slow down the process.
Yes.
So what does treatment involve?
So initial treatment for most people actually involves eye drops. Okay, we have a number of eye drops in the market that will help reduce the pressure, because if you remember the risk factors I mentioned, about the only one we can change is the pressure. We can't change your race, we can't change your family, and we certainly can't reverse your age. So the eye pressure is what we target in terms of treatment. So there are a number of eye drops in the market that, depending on what your pressure is and what the doctor sees, you will get some prescription for that. If that doesn't work, we do have surgical procedures that we can do to try and bring down the pressure. And we also have laser that can be done just to try and bring down your pressure.
A lot of people are wary of when you talk about surgery and lasers, when it has to do with their eyes, and you're feeling like, you know, they might just make the whole situation worse and maybe I should just wait it out. How do you deal with patients who are sort of hesitant in that regard?
Well, like I said, we do start with medical treatment, and I think we try our best to explain what's going on and what the progression of the disease is like. And every patient varies. Not everybody will end up needing surgery. So we try and encourage patients to be really diligent with their medication and their follow-ups. However, if we find that the medication is not working, then that it does take a long time to convince a lot of people, because especially if you're aware that this is not a cure exactly, yeah. But if you do understand the benefits of bringing down that pressure and how much more life in terms of vision you are going to acquire, then most patients do actually accept.
Right.
We do have a few who say no, but the majority will accept.
Well, here in Kenya particularly, do you feel like there's a general public understanding of this disease? Because you've said it does affect Africans more than any other race, but are we really aware of how serious this condition is?
No, I don't think the majority are. In fact, most people are usually surprised that, oh, there's a pressure in the eye, or there can be something going wrong in the eye and I don't know. I think mostly because in Africa still we have survival diseases. If I'm not going to die of this disease, then it's not an important disease. So I think the majority of people are still not aware of glaucoma. We've had a lot of publicity about diabetes and diabetic retinopathy, and I think now it's about time we start tackling glaucoma as well, considering that in the hierarchy, glaucoma actually has a greater prevalence than diabetic retinopathy.
No way.
Yes, it does.
That is interesting, and as you've mentioned with the statistics, this is likely to grow.
Yes, it is.
Unless we have the necessary information out there regarding diagnosis and screenings. And you wanted to mention something about the screenings.
Oh, yes. This week, second week of March, worldwide is Glaucoma Week, and we'll be having free screening in different parts of the country. So we had a screening yesterday at Mbagathi. Today we have it at Kenyatta National Hospital. Tomorrow it will be at Lions Eye First Hospital. And I believe on the 16th it will be at Kikuyu Eye Unit. Those are the units that will be doing it in Nairobi. But there are other units around the country that are also doing it. We have Coast General Hospital, Shiloh Eye Associates, and Lighthouse, that's down at the coast. And we also have Kwale Eye Hospital. We have Kisii and Kitale Eye Hospital on the western side. We have Moi Teaching and Referral Hospital, and we have Sabatia Eye Unit, and I believe Kenneth Matiba as well will also be screening. So during the whole of this week, right up to Saturday, any one of those institutions, you can pop in and get yourself checked out if you're over the age of 35.
Okay, so they're free screenings if you're over the age of 35.
Yes.
And you would encourage everyone to...
Oh, yes, I would encourage everyone to go and just take a quick look. It's nice to know that you're well. Yes.
To someone who might have a family member who's been diagnosed with this condition, in terms of care for them, what types of things would that person need to know?
Partly that depends on how advanced the disease has been. I would encourage you to help them take medication. It's very difficult to take medication every single day for the rest of your life. And it's helpful if you have family support and encouragement, just to keep you going on those days, especially when you just feel there's no energy to keep at this. So I think family support for the patients is very, very important, especially for those who may have to undergo surgery. It's a scary prospect, undergoing surgery, and especially in the eye, people seem to find that even more scary than other bigger surgeries. So I think family support is extremely important. The other thing maybe is being aware of possible rehabilitation, because for some patients they do come when it's a little bit late, and like I said, we cannot restore vision, but that doesn't mean it's the end of your life. There is rehabilitation available, especially for younger people who still are active and would like to keep working. We have Kenya Society for the Blind that does a very good job with rehabilitation. That doesn't mean that you have to be totally blind. Just if you have low vision and you need a bit of help, you know, seeing things, you need things to be magnified so that you can see it, they also help with that.
Right. Now, what is your hope for the future when it comes to this disease? And you've given us some pretty scary statistics of where this could be leading if we don't take charge and get ourselves screened. So what is the best case scenario for you?
Well, I'm hoping, one, that we will have a lot more information out there, because I think information is what drives patients to seek help. If you're not aware that there's a problem, you're not likely to look for a solution to it. So I think getting the information out as much as possible, that is what I would like to see, so that we have more people coming to request for screening, even on non-screening weeks, or even just people being more aggressive in terms of looking after their eyes with regard to everything. Because like even trauma, just getting hit on your eye can the problems, and a lot of people get hit on the eye and stay at home and be like, oh, it'll be okay.
Right, because we're waiting to see if my eye is not red.
Yes.
I might
just be okay. Yes.
Is there somewhere online where people can find more information, particularly about the hospitals that you mentioned that are offering free screenings this week, or any other information available?
Well, there is the World Glaucoma Week. If you just Google that, they do have a website, and they have lots of activities that are taking place all around the world. So you can just look for us there. But then again, any of the major hospitals as well. We have flyers being handed out around towns this week again. And like I said, if you walk into any major hospital that has an ophthalmologist in it, you can get the information that you need.
Right.
Yes.
Again, this is a nationwide effort, and I appreciate the work that you all are doing. Final comments from you.
Well, I would encourage everybody over the age of 35, please go and get yourself checked out. Even if not this week, at least sometime in the course of the year, get yourself checked out. Children especially, when they're born, at least within the first 3 to 4 months, if possible, get them to see an eye doctor and make sure that everything is fine with them.
Okay.
Yeah.
All right, Dr. Cindy Ogundo, thank you so much for stopping by Power Breakfast, for educating us and creating more awareness about glaucoma. Hopefully, lots of Kenyans watching will get out there and get screened, especially if you haven't done so already. All right, Power Breakfast does continue. We've got Man Cave coming up with Willis Raburu and the panel. That's after this short break. We'll be right back.